If our ancestors had these attractive faces and genetics did not change, is there a way to reverse the damage that we've done to our faces over the last centuries and actually make us look more attractive? Well, surprisingly, there might be. So most of the changes that happen to our jaws happen as our jaws are developing. But it still might be possible to improve our appearance, and that is by changing the environmental cues that cause those changes and allow us to have potentially wider faces and a stronger jawline. So, in a nutshell, there's a few things that you have to do to improve your facial structure and improve your appearance. So, the first is going to be breathing through your nose. So, you need to breathe through your nose at all times. We're going to get into that in just a little bit. Also, working on your posture and also strengthening your jaw muscles. So, there are a ton of benefits we get from breathing through our nose. And yes, it can change your appearance. So there was a guy whose name is James Nestor. He's actually a journalist. He wrote a book called Breath, and he did this experiment where he blocked his nose for 10 days straight. So he put these silicone plugs in his nose and he put this tape over it. So he was forced to breathe through his mouth for 10 days straight. And when he was doing this, he was tracking his sleep and he was tracking different biomarkers for his health. And the results are pretty interesting. So he found that immediately he started snoring and he started having sleep apnea. So he didn't have any sort of apnea or any sort of snoring before, but instantly he started snoring 4 hours throughout the night and he had sleep apnea, actually pretty severe sleep apnea. Also, his blood pressure went up. His other biomarkers for health went down. So generally he became unhealthier. And he even mentioned how his doctor described how he looked. And he basically said that he looked like crap. So there are some other studies that look at switching people to mouth breathers instead of being a nose breather in just their sleep. And again, in these studies, they found that their sleep quality went down, their sleep apnea levels skyrocketed, and there's other studies where people went from having no sleep apnea to all of a sudden having very severe sleep apnea just because they were breathing through their mouth instead of their nose. So we know that if we're not sleeping good, we're not going to look good. It's pretty obvious. So a simple solution to start breathing through your nose is at nighttime, make sure you're using a mouth tape and using a nasal dilator. So there's a couple of different types of nasal dilators you can use. You can use either a nasal dilator strip that goes over your nose and kind of expands your nose and expands your nasal passages, or you can use an internal dilator, which is something that kind of clips on in the inside of your nose and expands your nose that way. Both of them will work, whichever one works better for you. The plastic one is one that I personally like better because it's easier to put on, but it can also rip off your skin, or if you use lotion, it might not stick so well, so whatever works better for you. Now, I did make other videos kind of going more into detail on how you can properly do this, and for example, if you have a blocked nose, how to unblock your nose, there's an exercise you can do, and all the benefits you get from doing this. I'm going to put a link in the description below, because I'm not going to go over all of them in this podcast. But the second thing that you want to do, and this is one of the most important if you want to improve your appearance, is to improve your posture. Now, specifically, I'm talking about your tongue posture. Now, there are some specific tongue exercises you can do, but basically what happens is when your tongue falls to the bottom of your mouth, like when you're a mouth breather and your mouth is hanging open, your tongue will start to pull your jaw down because your tongue is what holds your jaw up. So if your tongue is resting against the roof of your mouth, it's going to pull your lower jaw up, and this is also in turn going to keep your head up. But when you become a mouth breather and your mouth is always hanging open, now your jaw is always going to be pulled down, and then your head is going to be pulled forward because your jaw and your tongue muscles are relaxed. And this can have really detrimental effects on your posture because your head weighs 12 pounds, but every inch that your head falls forward, that adds 10 pounds to your neck and your shoulders. So let's say your head starts falling forward 3 inches. That's a 42-pound head you have on your shoulders. And then what happens is your shoulders will start to roll forward, and you'll have what's called a forward head posture. And you probably know what I'm talking about because so many people have this, where their heads are chronically forward, and this could be because of a lot of different problems with their posture. You know, we have a lot of problems now with people, how they're sitting at desks all day long. I am a dentist, so I know about terrible posture because Whenever I practice, my posture is terrible. And a lot of times now we'll see this forward head posture where people's heads are forced to be forward. Well, your tongue plays a huge part in this. We already kind of described how your tongue is attached to the floor of your mouth and therefore attached to your jaw. So if your tongue is instead resting against the palate or the roof of your mouth, it's going to force your lower jaw to stay up and also keep your head back. And also your tongue is attached to your neck. Your tongue is basically a big cluster of muscles, and part of those muscles will attach to your neck muscles. So if you're able to strengthen your tongue, you're also going to be able to strengthen your neck muscles. This is going to help keep your head on straight and help with your overall appearance. So one exercise you can do is practice trying to hold your tongue up to the roof of your mouth, but push it up against the roof of your mouth for 2 minutes. Now, when you do this, you want to make sure that not just the tip of your tongue is touching the roof of your mouth, but also the middle of your tongue and the back third of your tongue. That back third is going to be the hardest part. You don't want it to touch your incisors because if you start pushing your teeth can start to flare out over time. You want that tip of the tongue to be touching that kind of rugged part of the roof of your mouth. And then the middle of your tongue should be touching the roof of your mouth. And in the back third of your tongue, this is going to be hard, but you want to focus on getting this up to the roof of your mouth as well. And when you do this, you want to push up for 2 minutes as hard as you can with your tongue. Then after 2 minutes, you want to use only half the amount of force, but keep pushing your tongue up against the roof of your mouth. Do that for another 2 minutes, and then half the force again, and then do it for another 2 minutes, and then keep doing it. And then eventually you'll get to a point where your tongue is kind of naturally resting against the roof of your mouth. And that is a position you want to keep your tongue at all times. And that is going to be the correct posture for your tongue. Now, there are some reports of people that can actually change the shape of their jaws and change the shape of their face many years later on in life, many years after their jaws are supposed to be done developing, by simply doing this and practicing this. So this was actually developed by a doctor named Dr. Mike Mew, and he studies something called orthotropics. Now, that is basically a branch of dentistry where you specialize in correcting people's jaw posture. And you might have heard this name because of a term called mewing. And this is basically what mewing is, where you're keeping your tongue in a proper tongue posture. Now, another exercise you can take from this is focusing on that back third of your tongue. Remember I said that that's going to be the hardest part to get up against the roof of your mouth? So what you might find is when you push this back third of your tongue up against the roof of your mouth, it might start to cut off your breathing a little bit. So in that case, you want to move it forward just slightly so that it does not impinge on your breathing. But what you can do is you can start to move this tongue back and forth to where first it starts to cut off your breathing and then it goes forward to its correct position. And if you keep doing this back and forth motion, you will start to get more control over that back third of your tongue. And this is going to help control where your tongue is supposed to be so that over time, naturally your tongue is going to be in the right position. Now, one reason that this works, especially when our jaws are developing, is that as our tongue is pushing against the roof of our mouth, then it'll stimulate our palate to expand. And this is what can contribute to that wider jaw. And this will also contribute to having enough room for all of our teeth. But the problem is when your jaws are done developing, then your jaw cannot move anymore because there's a suture in the middle of your palate. And that's where that bone will start to expand from. And what happens is during puberty, that suture in the middle of the palate will basically fuse and it's going to become impossible for that palate to expand, usually without surgery. But again, like I said, there are reports of people who are practicing this method of keeping their tongue against the roof of their mouth and able to actually change their facial structure. I personally think that it will have a lot of benefits. I don't know if it will actually change your bone structure, but it can definitely change your musculature around your jaws and still have a lot of effects with your appearance. And another exercise you can do is basically a natural neck lift. Again, this is going to be involving your tongue. This might be a bit of an annoying exercise, so I would probably do it when you're away from other people. So you're going to put your tongue again in that proper posture where it's resting against the roof of your mouth and the middle and the back part of your tongue are also against the roof of your mouth. And then you're going to widen your smile. So basically have like a really wide smile and then slowly let your lower jaw drop until your tongue falls from the roof of your mouth. So it's going to look kind of like this. So You can see it's making that snapping sound. That's a sign that you're doing it correctly. But if you do that for about 20 to 30 times a day, 2 times a day, this can start to give you a natural neck lift. Because what you do is when you're engaging a really big smile, you're also engaging your neck muscles. Because what you do is when you're having that really wide smile and you're opening your jaw like this, you're strengthening your tongue, but you're also strengthening your neck muscles. And this is going to help keep your head up in the right position. Now, the last thing I want to talk about with your tongue is when you're swallowing. When you're swallowing your food, I want you to focus on what your tongue is doing. So take a sip of water or try swallowing your saliva right now and see what your tongue normally does. Ideally, what your tongue should do is your tongue should sort of roll back and basically roll across the roof of your mouth and also push that bolus of food down your throat. So your tongue should be doing most of the work when you're swallowing. And if it's not, then you have a bad posture with your tongue. Now, if you do all of these exercises and you keep your tongue to the roof of your mouth at all times, it's going to really help, first of all, strengthen your neck and your tongue muscles, but also prevent your head from falling forward. And it's really going to help your overall body posture. But also, this will help you with your nasal breathing, because when you have your tongue resting against the roof of your mouth, then it's going to be basically impossible for you to breathe through your mouth. I can try it right now. I can't do it. So not only will this tongue position help with your overall posture, potentially improve your facial structure, but it'll also improve your breathing overall. And some people have this problem where when they're trying to keep their lips together, they start clenching their teeth, because that's the only way that they can keep their lips closed and the only way that they can breathe through their nose. This tongue posture can help with that, because instead, when you keep your tongue against the roof of your mouth, you're still pulling your lower jaw up, but now your teeth do not have to clench. And your teeth, ideally, should be basically barely touching each other, but not clenching each other. Another interesting thing about your tongue is one of the prime reasons people are picky eaters or picky to certain textures is because they have bad chewing and swallowing posture early on. And these foods that they're picky to become hard to eat, and they start rejecting them because they have this aversion to them. So potentially, if you correct your tongue posture, you might find that you're not as picky of an eater. Now, another thing to improve your appearance overall, another exercise you can do is improving your masseter muscle, which is basically your chewing muscles. So this is going to be basically affecting the outside of your face. When you talk about improving your tongue posture, it's going to improve more of the inside of your face. And if you improve the chewing muscles, this is going to improve the outside of your face here. So a simple way to do this is to chew more gum. So every time you eat, after you eat, a good idea would be to chew gum. Not only does this stimulate saliva, and it also can help clean your mouth a little bit, it will also help strengthen your muscles in your jaw. Now, if you have some sort of TMJ pain or problems with your jaw joint, you might want to avoid doing this until you get those issues resolved. But another thing you can try is something I found online called the jazzercise. So this is basically something that you can start biting on, but it's a way to actually improve your facial structure by strengthening those muscles of chewing. Now, another thing is to start eating tougher food. So stop eating super soft food diets, like stop eating liquid diets, stop eating foods that do not require much chewing, but foods like carrots or celery or harder, tougher meats would be really good as well. So one thing you might notice when you do these tongue exercises is you might find that you have a tongue tie. Tongue tie is basically when you have this really long attachment from your tongue to the floor of your mouth. Now, everyone has this attachment, but when this attachment is too long, then your tongue can become sort of glued to the floor of your mouth. So just to show what I'm talking about, I have this attachment. You can see it right there. If you weren't able to see it clearly, I'm also going to provide a picture as well to help. But some people might need a tongue tie surgery, which is a very simple surgery, but all it does is when you clip, or sometimes people laser that attachment, so that will give you more freedom with your tongue. So the thing with this surgery is it does not work if you do not use your tongue. So if you get your tongue tie lasered and you get more freedom with your tongue, but you keep doing this poor posture, then scar tissue will come and that tongue tie will come back, and it might come back even worse. So it's really important that you do these tongue exercises, and they might even give you more tongue exercises if you do decide to get a surgery, because you want to make sure that you're using your tongue properly. Now, a majority of people will not need a tongue tie surgery, even if they have a tongue tie. And a simple way to test if you have enough room with your tongue is this 2-finger test. So put your tongue up against the roof of your mouth, again with that proper posture, and see how far you can open your mouth and see if you can fit 2 fingers in your mouth while that tongue is against the roof of your mouth. Obviously, you want to make sure you have clean hands when you do this, but it's going to look kind of like this. If you can fit 2 fingers in your mouth while your tongue is resting against the roof of your mouth, then you should be good and you probably do not need this tongue tie surgery. It's estimated that more than 60% of Americans do not feel well rested when they wake up in the morning. Now, this has become a real problem because so many people are chronically tired. And this may seem normal, but I can tell you that it's definitely not normal. And a big part of this problem lies in the way that we sleep. So if you want to optimize your sleep, there are 3 things that you need to focus on.